Welcome back to Daytime Ottawa. It's a conversation that finally many of us are talking more and more about, and that is mental health and mental illness. And our next guests are going to be talking about some awards and also talking about a very important bill. We're joined by Member of Parliament Harold Albrecht. Harold, welcome to the show. Great to have you here. And Fred Phelps, who's a spokesperson with the Canadian Alliance on Mental Illness and Mental Health. Welcome to the show as well, Fred. And as I said, it's a conversation, it seems in particular in this community as well, but right across the country that more and more people are talking about. Obviously, more work needs to be done. Perhaps you can speak a little bit on that.
Most definitely. Thank you very much for having us here today.
Pleasure.
And great to be here with the champion of mental illness and mental health. Championed a federal bill to looking for a federal framework for suicide prevention. And really, I'm here representing the Canadian Alliance on Mental Illness, Mental Health, and we're a coalition of national organizations that, as you've said, have really, our purpose is really to bring mental health out of the shadows and to destigmatize mental health. And it has this government as well as other governments, but this government in particular has put forward a national framework through the Mental Health Commission of Canada and delivered a national mental health strategy that CAMI as an organization, I'll use the acronym because it's much easier and much quicker to do that CAMI was instrumental in starting and getting the Mental Health Commission started and then delivering the first national mental health strategy. And that's really huge in this country, and I think both in Ottawa but nationwide you've seen an opening up and a discussion that was really destigmatizing mental health and saying, you know what, I have a mental health problem, an issue or concern, and that's okay, and we can deal with that. And that conversation and that dialogue is happening all across Canada, and it's because of champions like Mr. Albrecht here that have put it on the table and have said, you know what, we can move this forward. And so what is happening Monday is something that CAMI has done for the last number of years. It's a Champions of Mental Health, and it's really looking across the country. There was hundreds of applicants, and there's people across this great country that are doing great work in addressing mental illness and mental health, supporting the people in the community, supporting their families, and that's really what it is all about. And Champions is highlighting those individuals, those gems that are in the rough, that are out there doing the work every day, and those that are on the high profile level that are actually making the issue come to the forefront.
Right.
That's amazing. And you are getting a special award on Monday as well. You must be very thrilled.
I'm thrilled, but I'm very humbled because the part that I played in this whole agenda is very small in contrast to the people who are working on the front lines every day. Those are the ones that really deserve the applause.
When did this issue come to the forefront for yourself, Harold?
Okay, for me, when I arrived in Ottawa, shortly after I arrived, I heard the story of Nadia Kajuji, a young Ottawa University student, or Carleton University student, who died by suicide at the hands of an internet predator. And it seemed to me that something needed to be addressed in the criminal code to clarify that while it's currently a criminal offense to encourage someone to die by suicide, if you were to walk up physically and encourage them and help them to do it, it wasn't clear in the criminal code that that also included telecommunications, internet technology. So I thought it was important to bring up to date our current laws and address the fact that if someone may not presume to hide behind the anonymity of the internet and think they can get away with a crime, that it should be punishable.
Now, so Bill C-300, how is it structured then? Can you sort of summarize it for us?
My primary goal in drafting Bill C-300 was to pick up on the great work that many agencies and organizations across the country are already doing.
Right.
So in my home region of Waterloo Region, there's a great community group there called the Waterloo Region Suicide Prevention Council. And these are replicated across the country, doing good work. But what they called for was a framework that would help them to connect with other groups in an easier way, to share best practices, to share statistics that are actually up to date. That's one of the big challenges right now. And you mentioned stigma earlier. The stigma surrounding suicide, surrounding mental health, is such that we believe that the actual incidence of suicides and attempted suicides is underreported. Right. So we'd like to draw attention to the fact that we do have an issue that needs to be addressed. There's good work being done. Let's collaborate. Let's bring those groups together and actually form a framework at the federal level that provinces can adapt their own particular situations or territories, but there's something available at the national level.
Now, what message do you want this bill to send out?
Well, my message from day one has been to create hope. I think when you come right down to it, those who are suffering of different forms of mental illness, and I'm not an expert on mental illness, so I want to clarify that, but ultimately it comes down to a lack of hope. All of us have experienced reversals in our lives, and we go through a discouraging time. And what you don't need at a time like that is someone to come along and offer sort of a permanent solution, death, to a temporary problem. So in providing the resources that someone may need in a downtime, give them that message of hope. It gives messages of hope to the Waterloo Region Suicide Prevention Council, who is now finding better resources, that will be finding better resources available to them. Message of hope to the families who are left behind after having dealt with death by suicide. I dealt with death in my own family 3 years ago, devastating time in my life, but I can tell you that it was the hope that I had from those around me, my family, my church family, my faith community, that helped me get through that time. And if we can bring that hope to someone who's going through a time of despair, that's my goal. Margaret Somerville, the ethicist from McGill University, said it best. She said, hope is the oxygen of the human spirit. Without it, the spirit dies. And I really do believe that.
Yeah, I couldn't agree more. And Fred, obviously, I think most people have met a family member, a friend who has suffered from mental health meltdown, whether it's long-term, short-term. What are the statistics out there? What are we looking at?
We're looking at 1 in 5. 1 in 5 Canadians experience mental health, mental illness issues in their lifetime. And really, in economic terms, that comes to about $50 billion annually to the economy. Loss of production, loss of the capacity of individuals being able to function within their jobs. And I think what we're looking at, and we're really at a cusp in Canada right now of really addressing mental health and mental illness and making workplaces a place that are safe to come out and say that I have a mental health concern or mental illness, and helping to address that and move things forward. Because mental illness and mental health, just like any other disease, heart, cancer, any other of those diseases, it is treatable and it is recovery. And that's really the hope aspect that Mr. Albright is talking about, is that there is hope, there is recovery, and there is manageable ways to move forward. And as a society, we're doing that together. And Monday, May 5th, when we have this event, we're having 6. There's Harold, but there's 5 other champions that are being heralded for their work in their communities, providing great work, whether it's community as an individual, a community organization, youth themselves that are bringing it in the forefront of their communities, within their own schools, bringing those people out of the work they're doing. And the word that we like to use often is bringing it out of shadows, bringing mental health out of the shadows and into the light. And
what about the healthcare perspective, Fred? Are we seeing more people in the healthcare field starting to recognize that this is a major issue across the country, and more funds and awareness being put into mental health care?
I think with the National Mental Health Strategy, one of our goals as an organization, as CAMI, is to keep on pressuring the government to apply more funds towards that, to move from 7 to 9% when it comes to applying funds to mental health. But we recognize that it's across the spectrum. It's local, it's provincial, and it's federal, right? And so we're looking and pushing for all 3 levels to come together with coordinated approaches, similar to a coordinated approach to a national plan to address suicide prevention, right? So there's one thing to have national plans, it's other to put the money and the resources into doing it. So when you ask, yes, I think many mental health, there's many mental health advocates, there's doctors, there's nurses, there's social workers that are all bringing that to the forefront. But as you say, as people are coming out of the shadows, we do have to have the resources to meet those needs. Right. And so that is part of our role as Canadian Alliance of Mental Illness and Mental Health, to keep that momentum going and keep it on the agenda. And that is one of the reasons why champions and other events are put in place, to ensure that it keeps on being moved forward.
Is that a conversation happening here?
One of my goals in C300 is to get it's not just a medical health problem.
Yes.
I would like to see coaches, minor ball, minor hockey coaches, for example, soccer and whatever else, other minor sports there are, teachers, frontline people who would be observing the behavior of a young person and maybe would catch the early warning signs and be able to help that person or persons to find the resources that they need. So if we can get that out into the mainstream, and I think coaches and teachers are probably some of our key people that we're missing in terms of the early prevention aspects of our education.
And I would put parents in that category as well, right? I mean, we need to know the signs. Melissa and I are parents. We need to know the signs, and people like the Alliance helps out with that. And there are resources available, but as you said, more resources the better. Thank you, gentlemen, for joining us today. Really do appreciate it, and congratulations, Harold.
Thank you very much.
Well deserved. Don't go away, because coming up next, we're talking about raising awareness and raising funds. Well, our next guests are doing just that with Bon Appetit Ottawa, one of the longest running food and beverage events raising funds right here locally in Ottawa. We'll be back with that right after this.